In addition to self-knowledge and self-evaluation, self-regulation, the ability to control one's behavior, is crucial to a child's development. Self control shows that a child knows what is expected by the world around them, realize which behaviors are appropriate for meeting those expectations, and understands how to adjust their actions accordingly. This ability to regulate behavior is essential for navigating social situations, achieving personal goals, and responding to challenges effectively. Emergence of self control. In the first year of life, self regulation is mostly reflective. As children grow, they gradually develop voluntary control over their behavior, allowing them to interact purposefully with the environment and produce desired outcomes. By the age of 2, children have developed many voluntary behaviors and can act on their environments in purposeful way. At 3 years old, children begin to resist having everything done for them and assert their desire to do things independently. They also start to recognize standards and react emotionally when they meet or fail to meet these standards, showing feelings such as guilt, pride, and embarrassment. During these early years, children begin to monitor their own behaviors and exhibit these affective responses. This period marks a significant transition where regulation moves from external sources, like parental guidance, to internal self management. As children learn to control their actions and emotions, their ability to self regulate becomes more sophisticated and nuanced. Compliance. Compliance reflects a child's ability to follow requests and adopt the behavioral standards set by caregivers. It involves both behavioral restraint and performance, meaning the inhibition of prohibited behaviors and the execution of requested behaviors. Interestingly, the capacity for inhibition tends to emerge earlier and more consistently than the ability to perform requested behaviors. Committed compliance occurs when a child internalizes and adopts adult instructions, often in situations requiring behavior inhibition, such as those involving the child's safety. On the other hand, situation compliance happens when a child complies with adult requests, usually under supervision and with caregiver support. This type of compliance is more associated with the production of requested behaviors and is often fleeting. Significant individual differences in compliance can be attributed to both temperament and parent-child relationships. Children vary along a number of temperament dimensions, including fearfulness and the ability to regulate their own behavior. Inhibitory control. Children who are more cautious or who can inhibit a dominant response have been found to be more compliant. Another crucial factor is the quality of the relationship between the parent and the child. Parental warmth is associated with high levels of self control in young children and teens. Children are most likely to comply in dyads marked by happy mood and mutual responsiveness to each other's needs and desires. Longitudinal studies show that mothers in dyads with a mutually responsive orientation have a history of being responsive to their children's signals of need, signs of distress, bids for attention, and social overtures. During the second year, children whose mothers were responsive to their needs tend to adopt a similar attitude toward maternal wishes. Resistance to temptation. Researchers often use the forbidden toy technique to assess children's ability to resist temptation. While infants have no self-control in this situation, being left alone with an attractive toy and instructed not to play with it, older children are better able to wait or resist the temptation. Children can be helped to resist temptation by observing an adult inhibit behavior in a similar situation, making self-inhibitory statements, or developing inhibitory strategies. Researchers have explored whether having children produce self-instructional statements during their waiting time affects their ability to resist temptation. In one study, 3 to 7 years old children were placed in a room with several attractive toys on a table behind them. They were instructed not to turn around and look at the toys while the experimenter was out of the room. Some of the children were also told that to help them keep from looking, they should repeat out loud a relevant statement, such as "I must not turn around." Children in a second group were told to use an irrelevant self-instruction, such as "hickory dickory dock." Those in a third group were given no self-instruction advice and waited silently. For younger children, producing a verbal self-instruction led to a greater resistance than remaining silent. Interestingly, the actual content of the instruction did not matter. The relevant and irrelevant instructions worked equally well. For all the children, the content of the self-instruction did make a difference, with the relevant statement proving most effective. Several other factors have also been shown to influence children's behavior in forbidden toy settings. For example, seeing an adult breaking the rule and play with the toys makes children more likely to do the same. On the other hand, providing children with a good rationale for following the prohibition, "Don't touch the toy, it's fragile and might break," increases the likelihood that they will resist. Teaching children to develop their own plans or strategies for dealing with temptation also helps. Delay of gratification. Self-control is also examined using the delay of gratification technique, where children are asked to postpone a small but immediate reward for a larger reward later on. Both younger and older children are more likely to delay gratification when they produce irrelevant statements. For example, saying something unrelated to the temptation can help them wait longer. Additionally, reducing the attention paid to a tempted object makes it easier for children to delay gratification. As children grow, they become more aware that redirecting their attention and using distraction are effective strategies for delaying gratification. Young children often don't recognize the strategy, but by the third grade, they start to understand its usefulness. By sixth grade, children are very aware of how these techniques can help them wait for a larger reward. Early ability to use distraction techniques along with greater social competence and certain personality traits, seems to be linked to the ability to delay gratification. Research has shown that adolescents who were able to delay gratification for a longer period as children tend to be more academically successful, have better peer relationships, cope more effectively with problems, and are more confident and self reliant.